to Esperanza Health Centers. My name is Carmen Vergara. I'm the Chief Operating Officer at the Health Center, and we're so excited for today. We've been waiting for this day for such a long time. I want to welcome Mayor Lori Lightfoot for being here with us today, and Dr. Allison Arwady. Thank you so much for all the support you've given us over the past 10 months. Today, we're excited that our staff members will be able to have access to the Moderna vaccine. It's a moment that we've been waiting for such a long time, and we are just so excited to be able to vaccinate all of our staff and just really launch this over the next few months for our patients here in the community where it's much needed. So I think we're just going to go ahead and jump into it because we're ready to go. We're going to do brief introductions with all of our staff members here. We have 5 who will be receiving the vaccine, and then 5 of our superstars who are also going to be delivering, administering the vaccine. So we'll do brief introductions for everyone. And we'll start here. Can you tell us your name, your role here at Esperanza?
Yeah, my name is Hilda Lopez, and I'm a lead medical assistant. And I'm very excited to get this vaccine today. I've been on site ever since the beginning of the pandemic. So I'm very, very excited. I've never been this excited before about getting a vaccine. So let's do this.
Thanks, Hilda. And Hilda will get her vaccination from?
Hi, my name is Isabel Camacho. I am the health center manager at Esperanza Brighton Park.
Great. So I'll go ahead and let you do your thing, Isa. He says just doing a quick wipe down. It's just normal process to giving a vaccine. And this vaccine goes into the muscle, just like a flu shot. All right. Nice job, thank you. And we're gonna be just waiting for 15 minutes, which is the normal process for this particular vaccine. Thank you, great job. Sure, yeah, okay, I get it closer. Sounds good, so we're gonna move on to our next team here. This is the second person who is being vaccinated. Can you tell us your name and your role here at Esperanza?
My name is Roberto Ramos, and I am the facilities manager here at Esperanza.
Thanks, Robert. And you've been here helping us with making sure that all of our testing operations are in order. So through his efforts, we've been able to test thousands of patients here at Esperanza. So thank you so much for everything you've done this year. And Robert will have his vaccine administered by?
Nate Pena. I'm one of the registered nurses here at Esperanza.
Thanks, Nate. All right, all done. How was that, Robert?
It was awesome.
Great. So our next team, our third team here. Hi, tell us your name and your role here at Esperanza.
Armando Ambriz, medical assistant.
And how many tests do you think you've done over the course of the past 10 months?
Thousands.
Yeah, I would agree. It has been thousands. And Armando's going to have his vaccine administered by?
Hi, Francisco Zamora. I'm one of the registered nurses here.
All right. And Armando requested his vaccine to be on the right side, which every patient can request what side of the arm they would like for their vaccine to be given. right. Armando's all done. Thank you, Armando, and thank you, Francisco. So moving on to our fourth team here. Can you tell us your name and your role here at Esperanza?
My name is Veronica Flores, and I'm a medical assistant in Esperanza.
And you also just finished your training. Can you tell us what you finished up your program in?
I finished my nursing program, so I'm going to become a nurse really soon.
Yes, it's so exciting. Another bilingual, bicultural nurse joining us, so it's so exciting. And Veronica's immunization is going to be given by?
Gabriela Alvarez, RN manager.
All right. Move out of your way, Gabi. All right. Nicely done. And then our last team for the moment, if you could go ahead and give us your name and your role here at Esperanza.
My name is Lorena Perez, and I'm a physician assistant doing the COVID testing here at Esperanza.
Thank you so much, Lorena. And Lorena's going to have her vaccine delivered by?
Roberto George, I'm one of the nurses here.
Great. And you're also finishing up a program too, correct? Yes.
One more semester till I'm done with my family nurse practitioner program.
Oh, that's great. All right, we're all done. Congratulations, everyone. How are you guys feeling? Good? Great. Well, thank you so much. If you guys wouldn't mind, for those who got your vaccines, waiting for another 15 minutes or so while we just kind of make sure that everything's okay. But thank you so much to our team of nurses. You guys were awesome. We really appreciate everything that you're doing for our staff members here. All right?
Well, welcome everybody. My name is, yep, sure. Sure. Oh, I'm sorry.
No, that's okay.
Great.
Everybody ready? Oh, let me wait for Craig. You ready? All right. All right, are we ready? All right. Let me first say to the folks today who received their vaccine, bravo. You are all people that have been on the front lines at an institution that makes a huge difference here in this community. And I want to thank you for all that you have done all that you are doing, and I am really, really proud and grateful to have witnessed you getting your vaccine. So congratulations and keep up the great work. Let me also recognize the other leaders who are standing with me today. Of course, Chicago Department of Public Health Commissioner Dr. Allison Arwady, Esperanza President and CEO Dan Fulwire, Esperanza COO and member of Illinois Unidos Carmen Varega, who's here, and I thought it was, there you are, Dr. Federico Herrera is the medical director at Esperanza Little Village, and Dr. Geraldine Luna, medical director at the Chicago Department of Public Health. It is great to be here to witness yet another milestone in our city's history and COVID-19 vaccination journey. These vaccines are giving us hope, La Esperanza, that we've been waiting for a very long time, and marking the beginning of the end of this terrible pandemic. We are here intentionally at Esperanza Health because it's a lifeline for our Latinx community. Esperanza COO Carmen Varega has been a critical member of our city's racial equity rapid response team and is a member of the Illinois Unidos, an organization I want to specifically commend for its tireless commitment to advocating for and uplifting the Latinx community throughout this terrible crisis. From the beginning, we have known that COVID-19 disproportionately impacts people of color, and we've come to learn our city's Latinx communities are bearing a very high burden, particularly in the second surge, tragically accounting for too many of our COVID-19 cases and deaths. While the numbers that we track, case rates, percent positivity, hospitalizations are in fact improving, portions of the Latinx community remain in crisis. And I want to make sure that we don't lose sight of that. The journey still continues. As I've said multiple times before, equity isn't part of our COVID-19 strategy. It is our COVID-19 strategy. And so I want to speak directly to our Latinx communities so we can continue to do everything possible to eliminate the disproportionate impact and burden that you are bearing once and for all. Since the spring, there has been much work, time and resources specifically dedicated to the Latinx community. There has been a focus not only for city government, but in part through the Racial Equity Rapid Response Team, but also by and with other partners like Esperanza and other organizations like Illinois Unidos, and through tables set by folks like Alderman Mike Rodriguez. That's why, in addition, starting today, we are taking the next step forward in our rollout plan by expanding vaccination distribution to long-term care facilities and beginning to distribute vaccinations to essential workers at higher risk outpatient locations like Esperanza. As Dr. Arwady will explain in much detail later, this is the start of a multi-week distribution process that will roll out over the end of this year, January and into February, as more vaccines become available, and include our federally qualified health centers like Esperanza Health. Workers at these facilities are overwhelmingly people of color and primarily serve our residents of color. And throughout the pandemic, these health centers have provided the critical testing, care, and resources needed by our vulnerable communities. You heard proof of point from the folks who sat today talking about the roles that they have played that are crucial during this pandemic. This includes our Latinx community, whose COVID-19 case and death rate numbers, as terrible as they are, tell a bigger story. A story that the steep challenges many Latinx residents have faced every single day during the pandemic, such as not having the privilege of working from home and serving our city in essential roles, sometimes multiple roles, in order to pay the bills and feed their families. For those workers, you are the people who help keep our economy running while doing your best to take care of your loved ones in their time of need, while somehow still finding ways to enrich our city's cultural landscape and get back to the neighborhoods you all call home. We know this, and we have to celebrate and uplift you for your contributions, but also for your sacrifices. But I also know this. Too many people throughout Chicago and in the Latinx community are going to work sick, because you can't afford to lose a dime to support your family, or you worry that you're going to lose your job, and you don't often have health care insurance or worry about your immigration status, so you may delay going to the doctor when you feel sick. The time span between seeking medical care and death for Latinx community members is the shortest of every demographic in our city, the shortest. What's heartbreaking about this particular data is that it may indicate that there's fear or apprehension which drives a delay in seeking medical care. So I want to say to our Latinx residents, please do not delay. There are people who can help you, regardless of your health insurance, regardless of your immigration status. When you feel sick, please seek care. We can connect you up to doctors, federally qualified healthcare centers in your community that can help you, such as Esperanza. But do not go to work when you are sick. There are protections available through our Office of Fair Labor Standards that can help you if you fear retaliation in your workplace. And again, I call upon employers to make your workplaces safe for all workers and ensure that workers will not be penalized if they follow the public health guidance and stay home when they are feeling sick. I know the challenges that many members of the Latinx community face and have been put up against. They may at times seem insurmountable. But I want you to know that we continue to be committed to your health and your safety, and that we are offering and extending a needed lifeline. That's why I've made it my priority to make sure that our Latinx community has everything needed to feel safe and supported, especially during these difficult times. We are here at Esperanza Health intentionally. Now, this healthcare center, which is so essential, serves the majority Latinx community of Brighton Park and continues to be an invaluable partner as we work to bring COVID-19 under control across our city, and why we're pursuing a number of additional initiatives specifically focused on the Latinx community and others. We've awarded a new testing site operations contract to Esperanza and Rush, working to bring more Spanish-speaking individuals to help with case investigations and community-based outreach in hotspot neighborhoods through our Protect Chicago initiative. Teaming up with diverse professional communications firm with expertise in Latinx and Black outreach to help our residents understand and be ready for the vaccine, and expanding coverage and forging partnerships with Spanish language media alongside Dr. Luna, and continuing conversations with Illinois Unidos and other Latinx community leaders to collaborate and implement strategies to mitigate the terrible impacts of COVID-19 on our Latinx neighbors. But let me remind you, we are and must be in this together. And just like we have a vaccine does not mean that the pandemic is over. And let me say that again. Because we have this vaccine, because we have hope that we haven't seen in months, it does not mean that the pandemic itself is over. Quite the opposite. We are still months away from widespread community distribution of the vaccine. That's why in the meantime, we must continue to do the things that we know will protect us and save lives, like wearing a mask and face covering, socially distancing, washing our hands regularly, staying home as much as possible, avoiding unnecessary travel, and keeping unnecessary guests outside of our homes, even beloved family members who do not live in the home, especially now during the holiday season. To everyone who found safe, alternative ways to celebrate Hanukkah, Christmas, and continue to do so during Kwanzaa, we thank you. But please keep up the good work as we approach New Year's and the coming days. I know how incredibly hard this is, especially for those who live alone. But we cannot afford to let more Chicagoans, our neighbors, get sick and die because of risky and irresponsible behavior. Yes, these vaccines are the light at the end of the tunnel, but we are still very much in that tunnel. In the coming days, weeks, and months, we will continue to work with community leaders and stakeholders, not only to roll out the vaccine in an equitable manner, but also to ensure that we have the trust in our communities, especially our Latinx and African American communities, so that individual members understand the importance and the safety of this vaccine. Anyone interested in learning more can visit our website, chicago.gov/COVID-VAX, V-A-X. That's chicago.gov/COVID-VAX. We are updating this on a daily basis with new information. And the progress that we've made both to address COVID-19 and the systemic issues it has surfaced have given us a glimpse of what's possible when we work together in partnership across the city to provide for our most vulnerable communities in this time of need. And now, as we continue our work to build trust among these communities through this next phase of this pandemic, I have no doubt that we will be able to be stronger and better because we will be together. This is what makes us stand out as Chicagoans, is our ability to rise to the occasion, to meet every challenge, no matter how difficult and how daunting. That's what we've done over the course of the last months, and I have no doubt that's what we will continue to do. And with that, I would invite Dr. Arwady to come to the podium and share a few words. Doctor?
Good afternoon. Thanks and congratulations again for being our first recipients of the Moderna vaccine here in the city of Chicago. So I just want to put a little bit of context in where we are in terms of vaccinating. So we are in phase 1A, which means we are vaccinating healthcare workers and long-term care facility residents. We've done 2 weeks of vaccinating so far. That has almost all been in hospitals, plus a little bit for our EMS, our paramedics. But this week marks a significant expansion in 1A to outpatient providers. And so this week alone, we are launching vaccination in long-term care facilities, both for residents and for staff. We are launching some direct vaccination distribution to some of our larger outpatient clinics, like Esperanza, and tomorrow the city is standing up its first central mass vaccination clinic, which again will be focused only for outpatient healthcare workers by appointment. So let me put a little bit more detail into this. This week, Chicago got another 21,450 Pfizer doses. Every one of those doses went directly to our hospitals. All 35 of our hospitals got vaccine in the first week. Everyone is continuing to vaccinate, working through all of the staff, ideally, and then starting to vaccinate outpatient providers who may be associated with that hospital. So week after week after week, we will continue to push vaccine to our outpatient providers. But today, in addition to Esperanza, we had 5 more federally qualified health centers who started receiving Moderna vaccine today. These were chosen because these are settings that are doing a lot of COVID testing and seeing a lot of positive COVID results. And over this week, there will be additional vaccine distributed to outpatient locations, especially the ones, public or private, that are doing a lot of COVID testing and diagnosing a lot of COVID. And then as the weeks go on, we will be adding more and more outpatient practices into that list as more vaccine is available. Also today does mark our first long-term care facility vaccination. We have 8 facilities that are starting to vaccinate today, 26 on deck for this week and 128 to get through over the next few weeks. So most of our Moderna allotment is actually going to long-term care facilities. This week we're receiving another 16,200 doses of Moderna, almost all of those to long-term care, and then some continuing through the outpatient. So it's a big week for expanding vaccine here in Chicago, but so far so good. We've been having good uptake, good distribution. We've not seen unexpected side effects. We've not seen unusual problems here. The rollout has been very good in terms of what we're hearing back from all of our vaccinating partners, and we expect to continue to really hear as vaccine rolls out into these outpatient settings that the vaccine continues to have the safety profile that we saw in in the trials. I do want to note that one of the reasons why this Moderna vaccine is exciting is because it does not require that ultra-cold storage that the Pfizer vaccine does. So one of the reasons that we can send vaccine to an Esperanza, to long-term care facilities, to these outpatient clinics, is that you can store the Moderna vaccine just in a regular freezer. And there's more time in terms of the ability to take it out and to have more flexibility. And so right now, these outpatient partners are starting with vaccinating their own staff. But down the line, they will be our primary vaccinating partners. When we move to 1B, we start vaccinating older Chicagoans, and then also we're moving into some of our frontline frontline essential workers. So we have had more than 20,000 vaccinations administered to date here in Chicago, and almost 2 million across the U.S. Through 12/26. So we're making good progress, but as you heard the mayor say, there is really a long way to go. And so I would first of all ask everybody, I know you are excited about the vaccine, I am too. We will be sharing more information really over these weeks to come as more of the logistics come into place about what it's going to look like for you to be able to get a vaccine. Right now, if you are in an outpatient, if you are a healthcare worker in Chicago and you're still not sure about how you're going to get vaccinated, the Chicago Department of Public Health, back on December 18, we did send a letter out and we've been doing a lot of outreach. But if you are at a practice in Chicago, that would be a medical practice, a dental practice, mortician, home health, you can go to the website, chicago.gov/COVIDvax, or just at the top, chicago.gov/coronavirus. Go to the vaccine tab. There's a healthcare provider tab, and you can get there. Somebody from your practice just needs to fill out a survey, let us know how many people are in the practice, we ask some more questions, and we'll be working to either get vaccine directly to your practice, get you hooked up with a hospital or a pharmacy partner, or be giving you appointments in our centrally based pods. So we do expect to have vaccine available for all of Chicago's healthcare workers, really in January and February, and then we'll likely be able to do some expanding out, which you'll hear a lot more about after that. But it is exciting. Things have been going really very well, and I would ask everybody to continue doing all the things that we know help. These having 2 vaccines available that are 94 to 95% effective, where the side effects that we're seeing, in many cases, people are not having side effects. When they are, you may have a day or two of a sore arm, possibly some fatigue or headache or muscle aches. We're keeping track of all of that, making sure these are not long-term side effects. These are not suggestive of any underlying problems. The vaccine has been shown to be very safe and has very good effectiveness. A second dose is required, so we will also be starting to bring the second dose in starting next week for our people who got vaccinated in the first week in Chicago. So that's really the update that I have. Please do go to the website if you have questions about anything related to COVID vaccine in Chicago, chicago.gov/COVIDvax. We're updating it every single day. And with that, I am very happy to introduce Dan Fulweiler, the president at Esperanza Health. This was such an easy choice for us, where we were thinking about where did we want to first roll out our outpatient vaccination, because you are doing so much testing, seeing a lot of cases, and just been standing up in a lot of ways related to the COVID-19, but even before and ongoing from that. So, Dan?
Thank you, Commissioner Arwady, and thank you, Mayor Lightfoot, for coming here to Brighton Park. We say it's the best park in the city of Chicago, so we're really happy to have you. I'm not supposed to say much, and I'm not going to say much, but I just want to say that it made me really emotional to see our staff getting their vaccines today. They have been through an incredible slog over the past 9-10 months, and I think a lot of times things get forgotten about when we talk about the hospitals so much. But these folks have been on the front lines too. We have tested over 30,000 individuals at Esperanza, and more than 6,000 of those people have come up positive. And our team has provided them exceptional follow-up care, making sure that they really got all the services that they need. So as the mayor said, we don't want you to wait. If your abuelitos are sick, if your sobrinos are sick, if your amigos are sick, please have them call Esperanza if they need it. There are a lot of other places that can help. We are here to help. Do not wait. And with that, I want to turn it over to Carmen Vergara, our COO. She is truly one of my healthcare heroes and has done a huge amount to make all of this happen that these guys do, and her leadership has been exceptional, and she's honestly changing the face of healthcare for Latinos in Chicago. So welcome, Carmen.
Thank you so much, Dan, and thank you for your leadership throughout the whole pandemic. I don't think we would have been able to get through all of this without your leadership and support. Good afternoon, everyone. My name is Carmen Vergara, and I'm the Chief Operating Officer of Esperanza Health Centers. I, too, have been incredibly excited and honored to welcome Mayor Lightfoot and Commissioner Arwady, and thrilled to witness the first vaccines delivered on-site to my Esperanza colleagues who have worked so hard this year. This is such a momentous step in our fight against the pandemic, and one that is giving us all a renewed sense of hope and confidence for the future. And I speak not just as a public health nurse or as an Esperanza team member, but also of a daughter of Little Village. It has been heartbreaking to see firsthand how the pandemic has devastated families in my beloved community, how rates of illness, hospitalization, and mortality, as well as job loss and economic uncertainty, have ravaged our communities and changed lives forever. I can't tell you how eager I am to start getting the vaccine out to those who need it the most. And that's why we're looking closely at the current guidelines on equitable distribution to make sure they really reflect what we're seeing on the ground and in the neighborhoods that we serve. We understand that a lot of these distribution decisions are based on what's happening across the United States as a whole, but here in Chicago, we know what the mortality rate is among our population here, and it's not the same. For example, mortality rate in the Latinx community tends to be highest among essential workers who are between the ages of 50 and 65 and not over the age of 75. We sincerely hope that the guidelines issued across the city will reflect that understanding and allow us to distribute vaccines to those who are most at risk. And that's why an equity lens is so vital as we roll out the vaccine and try to turn the tide of this pandemic on Chicago's hardest hit neighborhoods. I especially want to mention the Mayor's Racial Equity Rapid Response Team, which has made equity in vaccine delivery a priority and giving many of us in the healthcare a voice in shaping the decisions that will directly impact our patients. I feel that for the past 10 months, we've been doing our best by playing defense against this pandemic, offering test after test after test in our communities. But now, finally, we have the opportunity to go on the offense with the vaccine and with contact tracing and really turn the tide in this fight. So to all of my friends, neighbors, and family members in the community, please know that we are here for you as a resource. We are here to answer your questions and to provide information about the vaccine. You know, my own mom, Margarita Vergara, is a Spanish medical interpreter working with COVID patients at a local hospital, and she received her vaccine a week ago, and it was such an emotional moment for me when she sent me her picture. I have a sense of relief now knowing that she's well protected. Thank you, everyone. Buenas tardes a todos. Yo me llamo Carmen Vergara, soy la directora de operaciones de la Clínica Esperanza y siento mucha emoción estar aquí con ustedes y con la alcaldesa Lightfoot y la doctora Arwady en nuestra clínica en Brighton Park para ver a mis colegas recibir las primeras vacunas contra el COVID. Este momento es un paso gigante contra esta pandemia y nos da esperanza que podemos salir adelante. Yo digo esto no solamente como una enfermera o como miembro del equipo de Esperanza, pero también como alguien que creció en la villita. Me ha roto el corazón realmente ver de primera mano cómo esta pandemia ha devastado a nuestras familias y nuestra comunidad con las tasas de enfermedad, hospitalización y mortalidad, como también el desempleo y la incertidumbre económica que ha cambiado tantas vidas para siempre. No les puedo decir lo ansiosa que estoy como enfermera y como hija de la villita de poder proveer esta vacuna a aquellos que necesitan ya pronto. En este momento, la guía de quién recibirán las vacunas primero está basado en cómo la pandemia ha afectado a personas en todo el país y otras poblaciones. Pero en los latinos, aquí en Chicago, sabemos que las muertes son más altas en trabajadores esenciales de los años de 50 a 65 años de edad. Y este dato de información tiene que ser un factor cuando se decide quiénes van a recibir las vacunas primero. Es por eso que una perspectiva de equidad es tan importante al comenzar la distribución de la vacuna. Quiero mencionar y agradecer el Comité de Equidad Racial de la alcaldesa, que ha priorizado la equidad en la distribución de esta vacuna y ha dado a trabajadores de salud una voz en las decisiones que afectarán directamente a nuestros pacientes. En estos últimos 10 meses estábamos jugando a la defensa con proveer prueba tras prueba a nuestras comunidades, pero ahora estamos a la ofensiva con la vacuna y los rastreos de contacto. Quiero sugerirle a nuestra comunidad que por favor se ponga la vacuna en cuanto lo antes que puedan. No puedo decirles qué emoción me dio cuando mi mamá, Margarita Vergara, que trabaja como intérprete de español para pacientes con COVID en un hospital local, me mandó una foto la semana pasada recibiendo la vacuna. Me dio un sentido de alivio sabiendo que ella ahora está protegida. Muchísimas gracias. Now I would like to introduce Dr. Federico Herrera, our lead COVID-19 provider and site medical director for our Little Village Clinic.
Hello, everyone. My name is Federico Herrera. She said I'm the lead COVID-19 provider. I'm the Little Village site medical director. I've been working with the COVID-19 team since day number 1. It's been very hard, and I work side by side with the 5 members here today. I know what they've done day by day, day in and day out, what they do every day to help our patients in our community. I'm gonna keep it concise, so I'm just gonna give you 3 recommendations. Number 1, if you get sick, isolate. Number 2, if you get sick, seek medical help. You will find it, regardless of race, sex. You're just gonna find help. We provide it every day. And number 3, once it's available for everyone, now it's medical providers and long-term facilities, but it's available for everyone, get vaccinated. That's gonna help you, gonna help your family, your workplace, and your community. And with that, you're gonna start finally be able to defeat this monster, this pandemic that we've been fighting day in and day out for the last 10 months. Mi nombre es Federico Herrera, soy el director médico de La Villita, soy el médico líder de COVID-19. He estado trabajando con el equipo de respuesta de COVID-19 desde el día número 1 y he trabajado con estos 5 miembros que se han dado la vacuna hoy desde que los conozco, que han trabajado con nosotros. Sé lo que han hecho y lo que hacen día a día por nuestros pacientes y por la comunidad. Voy a hacerlo bien conciso, como dije recién. Van a ser 3 recomendaciones. Número 1, si se enferman, aíslense. Número 2, si se enferman, busquen ayuda médica inmediatamente. De vuelta la van a encontrar, independientemente del sexo, religión, color de la piel, van a encontrar ayuda. Y número 3, cuando Dios quiera sea pronto que tenga la vacuna disponible, por favor vacúnense. Se van a estar ayudando a ustedes mismos, a sus familias, a sus trabajos y a su comunidad. Y con suerte finalmente vamos a empezar a combatir esta bestia, esta pandemia que nos está afectando en los últimos 10 meses. Muchas gracias.
Muy buenas tardes a todos. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Qué emoción estar aquí hoy con Esperanza Health para presenciar otro hito de los esfuerzos de vacunación del COVID-19 en nuestra ciudad. Estas vacunas nos han dado la esperanza que esperábamos y marcan el principio del fin de una terrible pandemia. Estamos aquí en Esperanza Health intencionalmente porque este lugar ha salvado vidas en la comunidad latino-hispana. La directora de operaciones de Esperanza, Carmen Vergara, ha sido un miembro fundamental del equipo de la respuesta rápida de la equidad racial de nuestra ciudad y es miembro también de Illinois Unidos, una organización a la que quiero reconocer específicamente por su compromiso a defender y elevar la comunidad latina durante la crisis. Desde un principio, el COVID-19 ha impactado desproporcionalmente a las personas de color. Y como hemos aprendido, las comunidades latinas de nuestra ciudad están soportando la carga más pesada, lo que trágicamente representa una gran parte de nuestros casos del COVID y la tasa de mortalidad. Pero como la alcaldesa ha dicho varias veces, la equidad no es parte de nuestra estrategia, la equidad lo es todo en nuestra estrategia. Es por eso que la ciudad y el Departamento de Salud Pública quieren colaborar directamente con nuestras comunidades para que podamos eliminar esta carga desproporcionada de una vez y por todas. Muchas de estas comunidades no tienen el privilegio de trabajar desde su casa y están sirviendo a nuestra ciudad en trabajos esenciales, a veces más de un trabajo, para poder pagar las facturas y alimentar a sus familias. Ustedes son las personas que ayudan a mantener la economía de nuestro país, mientras hacen todo lo posible por cuidar de sus seres queridos en los momentos de gran necesidad. Sabemos que los retos parecen insuperables, pero se puede prevenir. Es por eso que estamos aquí en Esperanza Health Center, que sirve a la comunidad mayoritariamente latinos de Brighton Park y continúa siendo un aliado invaluable mientras trabajamos para traer el COVID-19 bajo control. Pero debemos recordar que todos estamos juntos en esto y solo porque tengamos la vacuna no significa que la pandemia ha terminado. De hecho, aunque estamos entusiasmados de estar aquí en Esperanza para hablar sobre nuestra vacunación en los trabajadores de la salud, faltan meses para la distribución general comunitaria. Por esa razón, es que debemos seguir usando las mascarillas, el distanciamiento social, lavándose las manos con regularidad, quedándonos en casa mientras podamos y mantenernos alejados de invitados o seres queridos y no viajar, especialmente en esta época festiva. No podemos permitir que más habitantes de Chicago, más de nuestros vecinos, se enfermen y mueran durante comportamientos riesgosos e irresponsables. Si la vacuna es la luz al final del túnel, sí, lo es, pero aún estamos en el túnel. Tengámoslo en cuenta. En los próximos días, semanas y meses, continuaremos colaborando con los líderes comunitarios y otros grupos, no solo para implementar la vacuna de manera equitativa, pero también asegurar la confianza de nuestras comunidades, especialmente las comunidades latino, hispanas y afroamericanas, para que se sientan cómodos y seguros al recibir la vacuna. Cualquier persona interesada en aprender más puede visitar nuestro sitio web chicago.gov/inclinada COVID-Vax, V de Víctor, A y X al final. A medida que continuemos generando confianza entre estas comunidades a través de las próximas fases, no cabe duda que seremos capaces de superar esta pandemia y poder disfrutar de un Chicago más saludable, más fuerte y más unido que nunca. Muchísimas gracias a todos y muy buenas tardes.
Thank you, Doctor. All right, happy to take your questions.
Hello, Mayor. Merry Christmas to you and Happy New Year, belated.
Same to you.
A number of questions directly related to this vaccine rollout.
Can you speak a little more directly into the microphone?
Yeah, does that help a little bit?
That's
Yep,
better. Thank
sorry.
you.
It's the getting used to talking through the mask. So I think Dr. Arwady mentioned 20,000 vaccinations had been done so far. Is that all of healthcare workers? And can you?
I'll defer to the doctor.
And what percentage have you gotten through so far of the healthcare workers? And are you getting the number of doses that you expected?
Yeah, so every week we have gotten the number of doses that we have expected. Really, to date, virtually all of the vaccinations that have been done have been in hospital-based healthcare workers. Just over 20,000 was from a couple of days ago, and we do update that every day on the website. I'll let you know that only includes healthcare workers who live in the city of Chicago. We found we're doing a lot of vaccinating of people who work in the city of Chicago in hospitals but may not live live here. Those doses are obviously all being counted, but when we report out about the number of Chicago residents who live here. If they're working here, they're at risk, we want to get them vaccinated, but I do want to put that point on it. We have hundreds of thousands of healthcare workers in the city, and so there is a long way to go, but we are ahead and really on track with where we would project in terms of vaccine rollout. And as I think the amount of doses stabilize, hopefully over these next few weeks, we'll be able to project out a little bit more into the future how long it will take to get through different phases.
And Doctor, this may be for you as well. Univision is just wondering how many frontline workers from the Latino and African American communities have received the vaccine?
Yes. So right now, the only data that we're able to report out is by zip code and by age. Race and ethnicity are being collected through the state, but we are using the state registry through the Illinois Department of Public Health to the point that there's a lot of vaccinating happening across different county lines, for example. We are working with the state to ensure that we can have access to that more specific race and ethnicity data, and it is absolutely in our plan to have that be publicly available just as soon as we can.
I think you addressed this earlier, but just so I'm clear for their sake, they wondered how can you ensure that the vaccination process is going to provide the vaccines for the frontline workers in these highly impacted communities, Latino and African American?
So related to healthcare workers or related to when we get to 1B?
I think related to healthcare workers.
Okay, sure. So related to healthcare workers, there's a couple of things. First is we're following up now with all 35 of our hospitals to say, how much of your staff have you gotten through? We've seen some hospitals have a lot of uptake. We've had some have not quite as much uptake yet. And so we're working sort of on an individual level with each of the hospitals to make sure that we're not just talking about doctors and nurses, that we're talking about the whole range of healthcare professionals who work in that hospital setting. Over the next week to two, there should be enough vaccine for all hospital-based workers to have received it, and we'd like to see uptake there. Where we think beyond the hospitals, though, that's where we start to see probably some more Chicago residents, particularly where we're thinking about healthcare workers and support roles. So as you'll hear tomorrow, I'll be talking in some more detail, but we are focusing on, for example, home healthcare workers very early here, where we recognize that home healthcare workers are more likely to be Black and Latinx, less likely to be connected to larger clinics or hospital settings, and are going to need probably some additional outreach working on barriers. So they're one of the groups we're focused on right from the beginning. This equity focus is really about where do we see lower potential vaccine uptake, and what can we do from an education outreach, but then also really lowering barriers to vaccination in those communities.
Who is going to be targeted in the mass vaccination, and where is that facility going to be set up at?
So this week we are starting, as you'll hear tomorrow, at Malcolm X, which is in the Illinois Medical District, recognizing that these are, again, medical workers that we are vaccinating, and it is also the site where City Colleges has its healthcare training program. And so that is where the first one, and we'll be having an availability there tomorrow morning for people to be able to see that site and talk in some more detail about how that will fit in.
Mayor, perhaps you can jump in on this if you would. This morning, I didn't hear what you had to say, but you did.
I apologize.
You were talking about.
I can't hear a word that you're saying. It's very muffled. Sorry.
Are you okay if I take the mask off for the questions? Okay. So you talked this morning about the long-term care facilities. Your thoughts, and are you happy with how this part is rolling out? And are you hearing about any issues or problems in the distribution in general?
Well, look, we've been working on this moment for months. And so a lot of thought and planning went into not only building the logistical infrastructure to make sure that we could get the vaccines out and quickly, but also engaging, as Dr. Arwady said, with the various healthcare partners. First, the hospitals, and there's a lot of dialogue with them going back weeks now, making sure that they were identifying the people, collecting data. We talked for a moment about how are we making sure that the vaccine is being distributed equitably. One of the first conversations that I had with the governor now some time ago about vaccine was making sure that it was mandatory that every place that does vaccines collects that demographic information. We don't want to be in a situation that we were initially at back in the spring where there was a lag in the collection of that demographic information, which put us behind in understanding the full impact of COVID-19 on communities of color. So we want to make sure on a daily, if not weekly basis, that we have real-time information about who's getting the vaccine, and if we see any issues in terms of disparities, that we're able to address them quickly. But that's why mandatory reporting out of demographic information is so important.
You rolled out the Pfizer vaccine at Loretto Hospital on the west side, sending a message to the Black community. Here, you're down here in Brighton Park. What kind of efforts are being done to make sure that people are getting the message that the vaccine is safe, and to encourage these communities where there is that apprehension that, you know, they've got to get it, besides just healthcare workers?
Well, in addition to what you've seen, we have for now weeks now, as part of our Protect Chicago plan, literally been going door to door in those high infection rate zip codes and providing information at the doors on how you can get tested, what the challenges are regarding COVID-19, what you need to do to protect yourself and protect your household. And now, since the vaccine has been out, we're also then providing additional information to these households about the efficacy, the safety of the vaccine. In addition to that, we have been really recruiting folks in the community that are trusted partners, particularly in community-based organizations, federally qualified healthcare centers, local practitioners, from doctors to dentists to nurse and so forth. And that work is ongoing because we believe, just as Dr. Federico said, we've got to have people who are on the front lines, that are seeing patients on a regular basis, who know the dangers of COVID-19, speaking directly to a potential patient population. So that's part of it. In addition, we put out an RFP recently for a communications firm, and specifically targeted and are now using firms that have extensive background and outreach into Black Chicago and Latinx Chicago. So this is a multi-layered strategy to reach out to people, to disabuse them of whatever concerns and myths that they have, but doing it with trusted local community voices. And that work will be ongoing throughout the entirety of the vaccination period, which we anticipate will be going deep into 2021.
Are you hearing about any problems in the distribution of the vaccine, and are you, as mayor, satisfied with how it's rolling out? Is it rolling out as you expected?
Well, I am, as Dr. already said, right now we have a finite amount that we've distributed. It's primarily gone through the hospitals. We are checking in with them to make sure that they are putting people in the queue that are front lines. Not surprisingly, the first few folks who got it in the hospitals were literally those frontline workers who were dealing with COVID patients. And as we get more vaccine, it will expand out from there. So this is very much a work in progress. But again, emphasis on equitable distribution and making sure that people of color are getting into the queue to get vaccinated. And we'll see, based upon the data as it comes in, whether or not we need to make any other adjustments in the plan. But this is the first time that we've done something of this scale. We've done, as a city, Department of Public Health, other vaccinations, but this is something in the context of a global pandemic that nobody has done before. So there are certainly going to be adjustments that we'll need to make along the way.
And just clarifying, these vaccinations we saw today are the first Moderna vaccinations in the city.
I believe
correct?
That's
Is
correct.
That's
yeah,
what
I believe that's correct.
I want to make sure that's what I understood. A couple of off topics, if you would. Obviously,
yeah, sure.
The Anjanette Young's invitation that was extended to you after you'd reached out to her lawyer. Wednesday, are you going to meet her at the church as she has proposed? And what about the public forum? Do you support that idea? Do you think that's a good idea?
So it's certainly my hope that Ms. Young and I will meet and meet soon. The details are being worked out, so once I have some specific confirmation, we'll certainly let folks know. The invitation for 50 members of City Council to gather in a church, look, I'll be honest and say that I've got some concerns about that. Number one, we're in a pandemic, and we have very specific guidance that's been out now for several months about the size of gatherings. 50 people plus in a setting would, I think, violate the public health guidance that we've given out. In addition to that, there are some other legal considerations, like whether or not such a gathering would be consistent with the Open Meetings Act, whether or not, depending on the topic that was discussed, whether or not aldermen would be close to breaching their fiduciary responsibilities, because we presume that this will be a topic that they may have to weigh on later. So there's a lot of considerations that members of the City Council are going to have to consider, but I'm not going to do anything that's inconsistent with the public health guidance that we provided.
But you have not committed to this meeting yet on Wednesday?
Well, there are two meetings proposed. There's one that's a one-on-one. I am anxious to meet directly with Ms. Young, and I'm hoping that the details can be worked out, so that will happen.
Okay. There was a protest, as you know, outside police headquarters yesterday, Chicago Tribune asking this, calling for policy changes on raids. After that situation, prominent activists, Democratic elected officials were there. What are your thoughts on that protest? And Lisa Donovan asking, why weren't you there?
Well, again, I try to follow the public health guidance. So that's issue one. Issue two, I've been in contact with many of the people that were the organizers of that protest, now going back a week, 10 days. And many of the things they're calling for are things that we have talked about, either me individually or collectively with them. So I'm confident that we'll get to the same place.
WTTW asking, Chicago is seeing close to 300 more homicides this year than in 2019. Is there any reason to believe that number will be lower next year? And if so, what will have to change? Yeah,
I think there's a couple things about that. You know, I have consistently throughout this year and even recently been in contact with mayors from other cities, and most of the major cities in the country have seen a pretty substantial uptick in violence in their cities. You know, different scale, but a proportional uptick. I've said this before, and I believe it to be true. COVID-19 has significantly impacted every facet of our public safety ecosystem. So public safety isn't just about the police. Public safety is about community-based organizations who do outreach and support individuals, families, and children. Now, we may not call them violence prevention efforts, but that's exactly what they are. The courts have been impacted. The jail has been impacted. Our federal partners were absent for the first 3-4 months of this pandemic. So everything that we depend upon to really build safe and healthy communities has been dramatically impacted by COVID-19. And based upon what I've read, what I've heard from fellow mayors across the country, many of us believe that COVID-19 is really the source in some ways for this uptick in violence. The other thing I think we also have to take into consideration is this. This has been an extraordinarily hard time on individual residents. There's a lot of trauma, depression, anger, frustration, and unfortunately some of that is playing out in violence. It's not a coincidence in my mind, for example, that we've seen a dramatic uptick in the number of cases involving domestic violence. We've seen a dramatic uptick in overdoses in our city and across the country. So a lot of the things that are manifestations of trauma and other mental health challenges have been really in full bloom throughout the course of this year. So what I hope will be the difference next year is we will keep making progress on our fight against the virus. We will vaccinate many more people. The ecosystem that we depend upon for public safety will come back online at its pre-pandemic levels. But no question whatsoever, we still have a number of challenges, and no mayor under these circumstances would be satisfied given the number of Chicagoans who've lost their life to gun violence. The last thing I'll say is this, and you've heard me say this before, but I think it bears repeating. We have to do a better job of loving and supporting young men of color in this city. There's no question about it. They are the shooters, and they are overwhelmingly the victims. But we also have to make sure that when someone does step over the line, and particularly when it means that another life is taken or somebody was injured as a result of gun violence, we cannot give them shelter. They have to face justice. They have to be held accountable for their actions. And in many instances, there are people in neighborhoods across the city who know exactly who the shooters were, whether it's of whatever age, and particularly of children. And again, I will call upon people, if you know someone who has caused harm, report it. There's lots of ways that you can do that anonymously and safely. There was just an announcement today that a third suspect in the death of Dwayne Williams, a retired firefighter, was found and has been charged by the state's attorney. And there's a fourth suspect that is being sought. None of that happens if people don't step up. None of that happens if people don't overcome their fears and recognize that as neighbors, we have a responsibility to each other. And part of that is holding folks who cause harm accountable.
Last question.
Need to ask about New Year's Eve. Kind of a two-part. Bill Cameron wants to know, what are your plans for celebrating the good riddance to 2020? But also, I'll let you answer that, but there's a follow-up to that, which is a bigger picture about New Year's Eve.
Well, given that I'm old, I'm usually asleep before midnight on any New Year's Eve. So it'll be New Year's Eve somewhere, which I'll celebrate. But in all seriousness, I will, New Year's Eve is also my wife's birthday. So we'll be celebrating her birthday that day.
Is there a message to others as everyone's looking forward to this? Is going to be a different New Year's Eve for
It has to be a different New Year's Eve, just as it was a different Thanksgiving, just as it was a different Christmas and Hanukkah and Kwanzaa. It has to be a different New Year's Eve. We saw a little uptick, meaning a little surge post-Thanksgiving. We don't want to see that again, either with Christmas, and we definitely don't want to see that again as New Year's. We are on a cusp of coming on the back slope of this second surge. We made remarkable progress over the last couple of weeks. We don't want to take any steps back because people feel like the vaccine is here, it's New Year's, and I'm going to gather in large groups. I'm going to not wear a mask. I'm not going to social distance. That would be a tragic, truly tragic mistake. We announced now probably 6 weeks ago that if we didn't take steps to really change things around, that we were going to see another 1,000 Chicagoans die by year's end. We've seen hundreds die, and we don't want to see that number go up one more person, but it will if we're not practicing social distancing, wearing masks, avoiding large crowds, and so forth. So my message to Chicago is remain diligent. We've come a long way on this journey together, and we cannot let up now. We've got to continue this hard work through the end of the year. There is light at the end of the tunnel, but as I've said now multiple times, stealing a line from somebody else, we're still very much in that tunnel. And we owe it to all the people that are getting vaccinated to stay diligent, because we don't want all this hard work, all this effort to be for naught.
Thank you.
Thank you.